Thousands of kilometers from the communities hit hardest by Ebola, scientists in the United States are feverishly working to stop the outbreak. VOA's Pearson reports from the headquarters of the Centers for Disease Control and Prevention in Atlanta, Georgia.
This is the Emergency Operations Center at the Centers for Disease Control and Prevention, the CDC. It's here that workers track public health threats around the world. Since March, they've been tracking Ebola. By September, the CDC issued a stunning projection that more than 1 million people could get the virus by January if immediate action isn't taken to end the epidemic. The experts in Atlanta provide critical information to those in the field, including the World Health Organization and governments in Liberia, Sierra Leone, and Guinea, the heart of the Ebola epidemic. Dr. Thomas Frieden, the head of the CDC, visited the Ebola's epicenter in late summer.
CDC has been on the ground for every Ebola response, and I personally assured each of the countries that we would be there with them until it was over.
In the Ebola-affected countries, billboards proclaim that the virus is real. CDC communications specialists help countries teach people how to stay safe and what to do if someone has a fever, the first warning sign of Ebola virus. The CDC doesn't send doctors to care for the patients. Instead, it trains healthcare workers to do it safely.
CDC is working in every aspect of the response in every country where the epidemic is present. We're helping patients get tested accurately. We're helping track the epidemic. We're helping countries improve the way they're responding to it. And we're helping to figure out what we can do to get ahead of it.
While early care dramatically increases survival rates, there aren't enough treatment centers, and many people are turned away, left to wait or die outside. Dr. Frieden says building more treatment centers and getting people into them is key to stopping the epidemic.
Time is absolutely of the essence. An action that's pretty good today is way better than an action that's great a week from today. It's that urgent.
U.S. troops are building new treatment facilities. More troops are expected to arrive in Africa in late October. Dr. Frieden says he is still confident that the Ebola epidemic can be stopped. But he also says it's going to get worse before it gets better. Carol Pearson, VOA News.